My name is Angela Hill, and I am the Value Analysis Clinical Care Coordinator for Valley Children's Healthcare. So when we decided to develop the hospital-wide team, we really wanted to look at the products, the intro products, who was impacted to determine who needed to be a part of the team. And in looking at that, we chose several clinicians, physicians, surgeons, case managers, ancillary departments that are also impacted, your dietitians, as well as key clinician staff, nursing, and some of our clinical areas that were also going to be impacted by this change to really try to grasp our hands around what was going to happen and what we needed to do. As we've gone through the ENFit implementation, there were really 4 key elements of our implementation that really helped, I think, make our hospital Stay Connected Task Force team successful. The first one being the identification of the product. By identification of product, the first thing that we really had to do to understand the ENFit implementation was to understand what products might be impacted by that. So we needed to look throughout our internal system to identify all the products that we use that could possibly be impacted by this ENFit implementation. Once we identified the products, we needed to make sure that we had a crosswalk to the new ENFit product. So when we were ready to make the transition, we had the new product ready and available for staff to use. As part of the ENFit implementation, we were going through the transitionary period. There were new pieces that we also needed to bring in, and we also had other transition connectors that needed to be in to support the transition between the legacy style products and the new ENFit products. Our second key to success for our hospital task force team was the identification of the impact, and I think this really helped us identify who needed to be a part of the team. One, it was really looking at who was impacted by this change, what kind of policies or practices may need to be revised or implemented as part of this change, and then really identifying the resources that were needed to support the change. The third key to the success for our implementation of the ENFit was really around our communication. Not only just our communication to our staff, letting them know that this was coming, what they needed to know about the change, but also to our patients and families and how it would impact them, as well as our patients that are followed by our home health. A key part of that during the supply chain transition was communicating well with our manufacturers on the changes that we were making sure that we had enough supply demands with them, providing them our usage so they could meet our needs, as well as our distributors, and really having weekly and sometimes daily conversations with them on where we were at with getting supplies, and then just having a backup plan for if something changed or something needed to be communicated to, then we were able to adjust and make that happen through the communication between all of those people. The fourth key to our success, I think, was the follow-up that we continue to do as part of our ENFit implementation. Some of it is identifying any issues that we may have had as part of the transition, identifying what the particular issue is and what we need to do to resolve it. Some of it is doing a wrap-up of how well did we make this transition work, what can we learn from it so we are prepared for the next transition that we have to do. And then finally, just being flexible. We had the best laid plans that we could, but as you know, as you move forward with product conversions, nothing ever goes smoothly. And so being able to be flexible and rethink how you handled things so that way you can come up with a different solution if you need to and move forward so that way your ENFit implementation can be successful.